Hospice is for those who are terminally ill, and what this means is that more than one doctor has determined that there's a high likelihood a person may pass in the next 6 months. Now, this is by no means a guarantee, and the key word is high likelihood. We do have many patients who have that 6 month time frame, but others who live longer. What we want to do is make sure that for however much time that the person has left, the family can really enjoy the time with our patient. The patient can live that life on their terms, and that we can really make a person as active as their situation may allow, or that they may be able to do some of those things that they've always wanted to do. These are all things that are very, very important to all of our staff and what hospice really means. One common misconception about hospice is about access to the primary care doctor. And I want to make it very clear that all of our patients can continue to see their primary care doctor while in hospice. I actually think this is very important because the primary care doctor is the one who has known your medical care and has known our patient for many, many years, decades, maybe sometimes even much of their life. I work very closely with the primary care doctors, so the primary care doctor can be involved in the care of many of our hospice patients. In hospice, we take care of our patients and our families with a team. One of the main team members is our nurse. The main thing that they do is they make sure that our patients' physical symptoms, health needs, and medical needs are all met. So very frequently, we might have a patient who has difficulty breathing. So our nurses specialize in managing a person with difficulty breathing. They're very experienced with the medications. Our social worker helps our patients and their families navigate through a lot of the social services that the government may provide, like in-home support service. And what this is the social worker can help get some funds from the government to help a family member potentially take care of the patient more frequently and for more hours. Our family support counselors help with the spiritual needs and the spiritual side of our care. And it doesn't even have to be religious. What we find is that when a person is going through a very difficult time, it really helps to have somebody who is very spiritually attuned to guide our patients and families through those difficult times. Our home health aides are very special, and our patients and our families really love them. They help with personal hygiene, personal care tasks. These home health aides really offload some of the more difficult tasks that need to be done to care for a person. What makes Asian Network Hospice special is all of our staff members. Most of them, grew up or have lived in a very similar community and cultural background as our patients. So this makes the connection very natural. When they go into the patient's home, they automatically feel like family or a really, really good friend. So it's almost like having a family member come in to take care of you who also happens to be a nurse. And I think that is something that's really special about what we provide to all of our patients and the families. I feel strongly that if not for many of the services that we provide, they wouldn't be able to get that bilingual, culturally competent care that we really, really value.
Là một y tá, việc làm của tôi là khám bệnh và báo cáo cho bác sĩ với những người trong nhóm về sức khỏe bệnh nhân. Tôi khám bệnh, chỉ cho gia đình các chăm sóc bệnh nhân, theo dõi tình trạng sức khỏe và giúp đỡ tinh thần cho bệnh nhân và gia đình. Rồi nhóm Hospice sẽ làm ra một chương trình để chăm sóc bệnh nhân toàn diện. Mặc dù Hospice là cho lúc cuối cuộc đời, nhưng Hospice cũng giúp tạo một môi trường chăm sóc cho bệnh nhân tốt hơn. Nhờ sự chăm sóc toàn diện này, có nhiều bệnh nhân có thể khỏe hơn và trở lại cuộc sống bình thường.
當時佢哋康寧服務有個職員打電話同我傾咗好耐，解釋俾我聽嗰個服務嘅宗旨啦，嗰個將來嘅服務嗰個態度或者個過程將會係點樣。咁我覺得都聽起上嚟就都幾適合我哋，同埋我都覺得聽起上嚟都幾滿意嘅咁，所以我哋就用康寧服務啦。主要佢係解釋嗰位 嗰位先生佢係解釋話，呢個服務嘅宗旨就係等個病人喺佢最後嗰個日子裏邊，可以喺屋企裏邊好好地咁過埋嗰個時間，同埋可以佢啲家人咧好容易咁接觸到佢、探望到佢，咁佢等佢有仍然有喺個屋企裏邊嘅感覺，係啦。
Tôi tên là Thu, thì tôi là mẹ tôi là bệnh nhân của một cái chương trình Asian Network, thì nhận được một sự rất là ân cần của các cô. Có những cái gì không biết là cởi mở rồi, coi như là giúp đỡ đến nơi để dễ hiểu.